Hello, it's Rafael Gutierrez. I'm going to talk about the appendicular muscles, and there's actually 23 words which are vital for you to understand to do well on this. I'm going to mention them as I go along. If you have the lab manual, you can see all of them and it will help you out. The other thing that's important is for you to actually have the bones and all the projections ready. So the first thing I'm going to do, and I actually drew this out a little bit earlier, you actually have an area here, and you can see the scapula coming here, and you can see the latissimus dorsi. This one here, running this way here, and over here too, is your trapezius, and you can see your scapula here. So what you have here is a triangle called the triangle of auscultation. And it is a place where you can hear the lungs really well, but the reason I'm telling it to you now is it gives you an area of a bunch of reference points. Now, your trapezius, we've talked about it. You can pull your scapula, this one here, back and down and also up. The reason that works is this one here will pull this way, this one here will pull down, this one will pull this. So together it does all three. The muscle here, the latissimus dorsi, helps you pretty much medially rotate your humerus. Also helps it bring it in, so abduction. And so you do have a lot of different movements that this latissimus dorsi does. And you can see where it's at really nicely. Now, if we were to remove the trapezius, you'd see muscles pulling the scapula here, which are called the rhomboids, go deep to the deltoid, which the deltoid would be here, because I want to show you the muscles, rotator cuff, and here you see them. Now, if you remember, this here is the spine of the scapula. This muscle here is right over the spine of the scapula, and it goes to the humerus here. So this muscle is called the supraspinatus. This one here that you see down here is under the spine, so it's your infraspinatus. This one here is your infraspinatus. Again, this is your infraspinatus. Your teres minor will be a little muscle coming on the side over here. And this here is your teres major. So you have your supraspinatus, your infraspinatus, teres minor, and the teres major. Now, the only ones that are actually rotator cuff are the supraspinatus, the infraspinatus, the teres minor. And if we flip over, you can see here, you have this big muscle here underneath the scapula. Call it the subscapularis muscle. We have the supraspinatus, infraspinatus, teres minor, and subscapularis. And I made it little because it's actually the teres minor that's important for the rotator cuff. Going back anterior portion of the chest, we can see that there's a big muscle here, the deltoid. Big muscle here you see up here is your pectoralis major. If you look on the other side, you can see your pectoralis minor here, and you can see a little bit of a muscle here, which is kind of serrated, which is a serratus anterior. Now, all these are going to be muscles that are helping you move your arm around. Mainly they're actually dealing with your shoulder. In this picture you actually can see that you do have a lot of the muscles. These here I talked about earlier called the rhomboids. You can see a lot of different muscles here. So levator scapulae. This one I do use a lot for my students, but over here we actually removed the pectoralis major, and what you see is you have a muscle with two heads, which is your biceps brachii. Underneath it you do have your brachialis, but I want to talk about these muscles here. Here you have a big muscle going from your humerus all the way down. Brachii is usually referring to the humeral region. So this one is going from the humeral region down the radius. So it's a brachio, radialis. Over here, you see the thumb, so that makes this a radius or a lateral portion. This is a medial. Over here, if you actually go on your own body, a bony projection, which is a medial epicondyle, you actually have four muscles coming this way, forming a little soft area here called the antecubital fossa. Now the four muscles you can see here. So the antecubital fossa is here. The biceps brachii here. You can see muscles coming here. One coming all the way to the wrist here, one coming to the palm of the hand, and one coming to the wrist here. Now remember, this is the radius, this is the ulna. And these two, this one here and this one here. So again, what you see is, you see the flexor, which means it's going to cause flexion of the wrist, causing this. Carpi, carpal for the wrists. Radialis runs here, going to the radius. Over here you have the flexor carpi ulnaris. And you have a third one here going to the palm of the hand called the palmaris longus. Now, over here, the fourth one is actually a really important one called the pronator teres. Now, the reason it's important is it gets you to move your hand from here and rotate it this way, which is called prone position. So that's supine, and this is prone. So you have your pronator there. Now on the other side, coming deep in here, you have your supinator, which is going to help you go from prone position to supine, like you're holding a bowl of soup. The other two muscles that you can see is if you go in there, you can see that you have one which is really superficial, going to the digits, which is called the flexor digitorum superficialis. You remove that one, and you come here, and you have your flexor digitorum profundus. And you'll notice that your profundus goes farther out than your superficialis. You can now see a lot of the muscles of the pronator quadratus there. Here, when you look at the leg, you have a triangle here. Over here, you have a ligament called the inguinal ligament, on this way. Then you have a muscle going from the anterior superior iliac spine all the way to the lateral side of the knee, across this way. Now, if you think about it, when this muscle contracts, it's going to pull the leg this way. It's going to cause a rotation and an elevation. This one's called the sartorius, and it's one of the really important muscles because you can see it forms a triangle. The other one is this one here, called the adductor longus. Now, what you have is you have a lot of different muscles causing adduction. Adduction is to bring stuff together. So they're inside the leg, causing you to bring your legs in this way, called adduction. You have your adductor longus. You actually have another one here, which is bigger, called the adductor magnus. And those three things make your femoral triangle. The reason that's important is a lot of times, if you have a hernia, you can find it here. It's also where you can find some blood vessels. Over here, you have another muscle that's really important, which you notice it's a small muscle, but it's attached to a really long tendon. This tendon is called the iliotibial tract, and the muscle is called the tensor fasciae latae. Back of the leg here. Over here, you can see the big muscle in the butt area called the gluteus maximus. If we were to go deep into it, we'd be able to see the gluteus medius, and deep to that, gluteus minimus, and you have lines on the bone called the gluteal lines. Now, coming down here, we have a couple sets of muscles. And we have an area here which is soft. This little area here. It's a fossa, so we call it, it's behind the knee, so it's a popliteal fossa. And what we have is we have two big muscles making on one side and on the other. Now over here, we have, if you notice, this is actually the outside part. This would be lateral, this would be medial. On the lateral portion, we have a muscle which has two heads, which is called the biceps femoris, which is this one here. It's the biceps femoris. Next to it, here, we have two muscles. One has this really long tendon here, called the semitendinosus, and underneath it, we have another muscle running here, and here, which is a semimembranosus. And so you can now end up seeing the difference. Now, you can feel this tendon if you were to feel the back of your knee and push, bend your knee and push down, you can end up feeling on the medial side a tendon that pops up. And that's your semitendinosus, underneath is your semimembranosus. With that, I'll end here. Hopefully you got some idea of how to look at the muscles of the legs. Again, a lot of this stuff you actually do want to look at it and make sure you can actually name what it is. I did give you some stuff that will help you out. And you can use the landmarks to find where you are. It will actually help you out in the long run. Thank you and goodbye.